Welcome back. In the late 1990s, a study linked childhood vaccinations to autism. Even though an investigation into the study proved the findings wrong, and even though the doctor who led the study had his license revoked for serious professional misconduct, the study planted seeds of fear and set off an anti-vaccination movement. Dr. Holzman and Stacy Anderson from the Montana Department of Public Health and Human Services are still with us. So, we're back. Yeah. I'm going to go to you, Dr. Holzman. Let's talk about that anti-vaccination movement. If vaccinations are so effective, why do people resist getting them?
Yeah, it's interesting. Since the first vaccine came about, which is actually 1797, was when the smallpox vaccine was first figured out, there's always been an anti-vaccine movement, and that has gone on. We just recently did work on the pandemic flu of 1918, 1919 here in Montana, and during that aside thing, we saw there was a big uproar about smallpox vaccine in Butte, Montana, of a group of people. It went to the Board of Health that said no, they had to get their vaccines, went all the way to the state board that supported them, and the vaccines were given. This issue has already gone all the way to the Supreme Court in 1905 about individual liberties versus community protection, and again, vaccines were supported in that ruling of Jacobson versus Massachusetts. So I think the issue is that's been around. But the point that I think is even more that we need to demystify on the myth is that it's big. Because if you look at a Pew survey that was done in 2017 showed that 88% of Americans believe that vaccines are safe and the benefits highly outweigh the risk to get vaccinated. If we look at our own data in Montana, that we'll see in many of our areas, polio vaccine in kids, up at 88%. We see things, these areas that we see this constant increase in numbers of people getting vaccinated. So there is a small percentage, and there's different reasons that people choose not to get vaccinated or delay vaccinations. But overall, the movement is actually fairly small, and most people see and look at the data to say, this is a good thing.
So let's switch to you, Stacy, and tell us about that Wakefield study from the 1990s. Why did it cause so much concern about the MMR vaccine?
So the issue with the Wakefield study was Dr. Wakefield and some of his co-authors did this study that was looking at young children who were developing signs of autism around the same time that they were given their first dose of the MMR vaccine. And so, in science, one of the things that we have to look at is you can make a connection like that, but can you truly establish what's called a causal relationship, meaning does that event truly cause the outcome? And the problem with that study is that was the conclusion that Wakefield wanted to draw, was that people who were getting MMR vaccine were developing autism. And in fact, that was incorrect. And as you said earlier, that study was eventually revoked. It was reviewed, found to be that some of that data for that study was not only a very small number of individuals, which is very hard to study. You need larger samples, basically, to study something well. But also the data was falsified. And future studies could never reproduce that same result. In fact, future studies have shown that there is no link between the MMR vaccine and the development of autism. And so, as you mentioned, Dr. Wakefield lost his license. The study was pulled back and discredited. And so, I'm here to say there is no link. There is no link between receiving an MMR and the development of autism in the scientific body of knowledge.
So to follow up on that, he was discredited, the study was discredited, yet there are still naysayers who are not vaccinating. So why would that be all these years later?
Well, it did take some time for that study to be discredited. There was quite a period of years between the study's results and the following retraction of the study that resulted in a lot of discussions and with people talking about how these were definitely connected. Mm-hmm. And of course, if you're a parent and you're seeing this happen, it's scary. You want to know why your child developed these symptoms, and you want to make sure that you educate people around you as to, oh, well, this is what happened, so I don't want it to happen to you. a lot of that kind of continued on until the study was officially retracted. And then sometimes it's hard to change those modes of thinking all these years later. They become.
And I think there's some other aspects that I would add on to what Stacy talks about here, is the sense that, one, autism is scary, and we're seeing it go up in numbers, and we want to understand why. I think it's sad that we continue to pay so much time in trying to revoke this, kind of going over and over again on that, where we should be putting it towards trying to understand autism and see if there's ways that we could do better on prevention and better treatments of that. The other thing that I think, social media probably has an effect too. I mean, we all go to the sources that that we feel best, and so sometimes we will go to a source that, I use the word data, and I use that loosely, that we have the data that supports our pre-held belief, instead of being able to continually to look at the bigger picture and look at the other side's viewpoints to come to those answers.
So we've got about 30 seconds left, and in that time period, can you briefly describe the types of people that shouldn't get vaccinations? Who are they?
It's very minimal, but there are some times that you'll find a medical reason not to get vaccination. Just to give you an idea, in Montana, about 0.4% of children have a medical reason, and that might be because of an allergy that they have to a component within the vaccine, or it might be that they have a decreased immune system, or reasons that they can't get a specific vaccine. Sometimes it's that they can't get one or two different vaccines, but they can get the others. So talk to your provider and go through that.
We need to pause here and take a quick break, but coming up next, we'll talk more about the impact the anti-vaccination movement is having on public health and what's being done to overcome it. Don't go away.